Our post-rehab tip for this month involves how to utilize McKenzie exercises, or you may frequently hear these called extension exercises. We start with the McKenzie exercise with our client just simply lying in the prone position. She can have her head along the midline, or she can turn her head right or left, whichever one is most comfortable for the client. So the first position is just simply prone lying. We leave our client here for 30 seconds. The idea of the McKenzie exercise or the extension exercises is to push the disc anteriorly, which means we can actually take the compression off the nerve root. So lying in the prone position starts this process. So the disc is actually being pushed anteriorly. Next, we're going to ask our client to go into what we call a prone prop. So she's going to bring her elbows under her torso, and we're going to put them right under the shoulders, and she's just going to simply lift her torso up, keep her pelvis on the floor. So this is called a prone prop. We'll leave our client in this position anywhere from 30 seconds to a minute. And after that time period is up, whichever time period you select, the 30 seconds to a minute, we're going to let the client go back down, all the way back down into the prone position. Stay here for anywhere from 30 seconds to a minute, and then come back into the prone prop position again. Okay? Now, as you can see here, we moved her into extension, so that disc is being pushed anteriorly now. Our next position is the prone press-up. What we're going to ask our client to do now is bring the hands in underneath the torso and then just simply press up, but keep the pelvis on the floor. We're going to try to lock the elbows out as best we can, but for some clients that's almost impossible. Again, you could see here that we've increased the amount of extension here. The client again holds this position anywhere from 15 seconds to 30 seconds, and then they go back down into the prone position, all the way back down. Again, they rest here anywhere from 15 seconds to 30 seconds, and then she comes back up again into the prone press-up position. And again, this is vigorously pushing the disc anteriorly. She goes back down and she relaxes. The key thing to remember here with the McKenzie or the extension exercises is the following. These exercises were specifically designed for clients with disc herniations and radiating pain down the leg. By pushing the disc anteriorly, what we hope to do is centralize the pain that the client has in the leg by bringing that pain back up and centralizing it in the lower back. The McKenzie exercises or the extension exercises were not designed for all lumbar clients. What you have to do is make sure you have a clear understanding of what the client's pathology is before you just simply arbitrarily start them on McKenzie exercises or extension exercises. These are designed, as I said again, designed specifically for the client with disc herniations.